I'm Margaret, and I was in the group with Joanna and Emma, and we decided to do a presentation on epilepsy. So epilepsy is a chronic disorder that causes unprovoked recurrent seizures. It's also characterized by a loss of consciousness, sensory disturbances, and other behavioral abnormalities. About 1% of the US population has been diagnosed with epilepsy. And this might seem like a small number, but actually 1% of the US population is about 2 to 3 million people. And so about 200,000 people are diagnosed with epilepsy each year. So what are some causes of epilepsy? It all kind of stems from irregular brain activity. Epilepsy is developed at any age, and some people are born with a defect in their brain structure, but other people can also have primary central nervous system disorders, metabolic or system disorders, and then also idiopathic origins. And so what the CNS disorders are is they can include all types of strokes, any potential mass effects like tumors, abscesses, atrioventricular malformation, aneurysms, or hematomas. So, stroke is the leading cause of epilepsy in adults who are older than 35 years old. The next would be metabolic or systemic disorders, and what this is an imbalance, and also it can come from acute overdose, drug withdrawal, hypoxia, and also electrolyte imbalances or disturbances. And what idiopathic origins are is it's basically they just don't know why epilepsy is occurring. Like there's no significant reason that would point to it. Some symptoms of epilepsy are, the most common would be a headache, and then there is irregular stiffness in arms and legs, hallucinations or illusions, bodily fatigue and sleepiness, ARO, which is temporary loss of muscle control in the body, pins and needles, fumbling of hands and feet, confusion, amnesia, and staring spells. And if you think about it, all of these symptoms kind of don't seem like they're related, but if you look closely, you can see that they all come from an imbalance in the central nervous system. And this can be from sensory to brain function and also motor skills. So some risk factors start usually with age as being the most important because the highest likelihood occurs in children who are under the age of 2. And this is usually because of birthing difficulties or early infections that occur in the brain. And then it goes to adults who are over 65 years of age. But if you're in between this age gap, you don't have a really high risk of developing epilepsy. That is, of course, unless you have a family history of epilepsy. If you have a head injury, a stroke, or a vascular disease. Also, if you have a brain infection, encephalitis and meningitis are the most common. Also, if you have dementia, but that usually comes later with age, and that's in that 65-year age range. So next, this leads to assessments and how to diagnose epilepsy. First, physicians usually start with obtaining a patient history, and this starts by examining any past illnesses or surgeries that the patient has had, especially examining any injuries. Most common would be a head injury. Second, they look at any lifestyle changes that the patient may have had, and this could be anything from an adverse reaction to a vaccine or a change in medication. Thirdly, the doctor has to examine any seizure-specific history that they have had, and this is really important because it involves looking at the age onset of the seizures that they have had, their frequency, how long the seizures might last, and also their severity. And they have to obtain this from the patient themselves, but also other people who have observed the seizure themselves. And the patient need to know from the patient if they've had any warning signs of the seizure coming on, or if there are any specific things that trigger it, like it could be flashing lights or fatigue or dizziness. That leads us to physical exam. Number one, the physician will make a neurological exam, and they'll do this by assessing the changes in the patient's mental status, their nerve function, and also their muscular tone and strength, along with their reflexes. And then secondly, they'll also monitor seizure activity, and this kind of goes back to point 3 of part 1, but this time they're actually monitoring the seizure itself and not from what other people have told them about it. So when if they do have the chance to observe an actual seizure, they have to look at the patient's gaze, their pupil size, any incontinence that they might have, and they have to know the length of the seizure itself. And then number 3 is probably one of the most common things doctors will do is perform an MRI or an electroencephalogram test, and that will be administered. And we'll go back to that in a minute, but something that's also really important is to look at this from a nursing diagnosis perspective, because the assessment and the diagnosis of parts 1 and 2 kind of goes from a physician standpoint, but as nurses we have to look at this from a diagnosis and outcome interventions way. And so how we can do this is by making sure that the patient's airways is effective, and because during the surgery they're going to be really stiff and they're going to be jerking and seizure movements. They might also have a tongue obstruction, and so it's super important to make sure that they're getting air and that we're just monitoring for them for those symptoms. Outcomes, we have goals, and this is to keep the patient's respiratory status and gas exchange effective, but we also have to make sure that they're safe, because when they're having a seizure, they're not going to be in control of their bodies, so we have to make sure that their environment is safe and that they're not going to hurt themselves. And then interventions, just always making sure that there's an airway insertion or a device nearby, and always make sure that they're breathing. And then this goes back to what we were talking about before with the MRIs and the EEG. So the picture on the left is an MRI, and you can kind of see that there are 3 brain pictures, and each one there's a different problem in the brain, but this is a cause of epilepsy. So to the far right, you can see at the bottom left of the brain there's a stroke, and then in the middle there's a picture of a tumor, and then to the far right there is sclerosis in the mesial temporal lobe, and all of these are causes of epilepsy. And then to the far right is the EEG, and what it is physicians will attach electrodes to the patient's scalp, and what these do is they monitor the electrical activity of the brain, and they'll read the scan and they can kind of check for abnormalities on the reading. This kind of leads to some treatments and follow-up care. There are 2 types of treatment for epilepsy. One is medical, the other is surgical. So medical treatment of seizures is using medications, but it's also treated pharmacologically, which means that doctors prescribe oral medications to the patient. But also sometimes they have to use IVs, especially in emergency cases when the patient can't have time to eat the medication themselves or take it orally. And it's important to get them the treatment that they need, because seizures are an emergency situation, and without the medication that they need, they can get permanent brain damage or even experience death. Next would be surgical. This is important because there are a lot of people who have intractable epilepsy, and this means that medication doesn't work on them. And so 50% of these people with intractable epilepsy, they have surgeries with very good patient outcomes, and there are good candidates for these. And it really depends on the part of the brain that is affected, that is causing the epilepsy, but there's a wide variety of seizures or surgeries that can be performed. And then follow-up care and prognosis. It's important just to know that the patient understands their medications and the situation they're in. Epilepsy is a pretty dangerous thing because they can harm themselves, and if they don't have people who are around them who know how to take care of them, they won't know how to take care of themselves when they're having a seizure. So it's really important that they understand the extent of their disorder and how to take care of that. And that's it.
You need more stories.